Hi, I'm Milly. I'm a physiotherapist and I've been working in the NHS and in the private sector for the last 7 years.
Hi, I'm Chris. I'm 53. I'm a severe arthritis sufferer and I'm waiting for replacement surgery on both shoulders.
Today's video is going to be a series of shoulder exercises that you can do before your surgery and also exercises that you will probably be doing after your surgery as well.
How do the exercises actually benefit us?
So the exercises before surgery are really important because they make sure that you maintain your fitness. Having good fitness in your heart and your lungs is going to help you get through the surgery, but also keep you fit afterwards as well.
But what about if you experience pain during the exercises?
Yeah, so it's normal to be a little bit uncomfortable when you're doing some of your shoulder exercises. Just make sure that you're not pushing yourself too hard and that you're listening to your body. We're going to do a demonstration of each exercise so that you can follow along, but feel free to pause the video and make them a little bit harder or do them for a little bit longer if that suits you. So our first exercise is called a table slide exercise. We like to start this one in sitting, and then you can progress to standing, and then eventually you can move to doing the exercise up the wall. The exercise is with your hands on the table. You're just going to slide your hands up the table as far as you can go and then bringing them back up again. This is a really nice gentle movement exercise. To make it a little bit easier, you can hold your hands together and use your hands to go as far up as you can. So you're assisting yourself a little bit more because your hands are together. You can have your hands flat down on the table or they can face each other, whatever is more comfortable for you. To make your flexion slides a little bit more difficult, you can do them at the wall. So come to the wall, just standing a few centimeters away from the wall, hands flat, and then just sliding your hands up and then bringing your hands back down. To make the wall slide a little bit easier, you can just crawl your fingers up as high as you can go and then bring them back down nice and controlled. So Chris, would you like to do some exercises with me now? So we're going to slide forwards as far as you can go. Make sure that you're quite relaxed when you're doing this exercise. And just see when you get to as far as you can, if you can just go a little bit further with your fingers and then pull yourself back. Good. So Chris, just use your fingers there to creep yourself forwards a little bit. Lovely. And then come back. Good. If you feel a little bit of a stretch in your shoulder, then that's okay. This is a movement exercise. Good. Lovely. Good. How are you feeling, Chris?
That was really good. I felt a pull across the back of my shoulders. I felt it really opening them up.
Perfect. So our next exercise is abduction of the shoulder. You can start this one sitting down in a chair, being nice and comfortable, and then you can progress into standing, and then also by doing it next to the wall. What we're going to do is just nice and comfortably hand down by your side, just lifting the arm out to your side and up as high as you can go. The arm might not come all the way up to your ear. It might only come just a few degrees away from your body, and that's absolutely fine. So when you're ready, Chris, let's take the arm out to the side and back down. Good. Up and down. Up. Just see if you can go a little bit further and down. Up and down and up and down. Great. How was that, Chris?
That was really good. Really good. I felt a tightness in my arm. I felt it was pulling it out.
Good. So having a feeling of pulling in your arm is okay. It means that the muscles are strengthening. Just make sure that it's not painful and that you're going at your pace.
That's really good.
So our next exercise is called internal and external rotation of the shoulder. So you're going to bring your elbow into your side and bend your elbow to 90 degrees. You're going to squeeze your hand as much as you can, so you're really doing a fist with your hand. And then you're going to take your hand away from your body and then bring it in to your tummy. So out to the side and then into your body. And what you can do is you can start in sitting, or you can even start with your hand resting on a table, just to give you a little bit more support. So when you're ready, Chris, bending the elbow and then taking the hand away from you, keeping the elbow tucked in and in. Away and in. Away and in. Good. Away, in, away, and in. Lovely. So the next set of exercises are called isometric exercises. An isometric exercise is when you are strengthening the muscle, but you're not actually moving the arm, and they're a really nice way to get your shoulder stronger. We're going to be doing isometric flexion, isometric external rotation, and isometric abduction. So what you're going to need is something to just protect your hand at the wall. You're going to stand face onto the wall for isometric flexion. Making a fist with your hand, you're going to imagine that you're punching into the wall, and you're going to then hold that between 1 to 10 seconds depending on how your shoulder feels. So punching and then holding. So Chris, would you like to give that a go?
Yep.
There's the towel. Good. So you're punching the wall away from you, pushing the wall away, and we're going to hold that for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay. How did that feel, Chris?
That was great. I felt it all at the back of my arm and in my shoulder joint.
Excellent. So even though you're not moving your arm, you're still getting a good contraction in those shoulder muscles. The next one is going to be isometric external rotation. So for this one, you're going to stand with your whole forearm against the wall, and then you're going to push your wrist into the wall. So we're holding again between 1 and 10 seconds, just as much as you can feel it. Okay, Chris? Good. And we're holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. How did that one feel, Chris?
That was surprising. That was right in the back of the joint.
Yeah.
It really was. Yeah.
So again, with your external rotation, it uses a lot of the muscles at the back of the shoulder. So this is a really nice one to start getting that a bit stronger. The last one is isometric abduction. So this time you're taking your elbow into the wall rather than your hand. So again with the towel, forearm on the wall, pushing your elbow into the wall, making sure you're still squeezing your fist as much as you can, and you're going to hold this between 1 and 10 seconds depending on how you feel. Okay, and then we're going to hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. And how was that last one?
That was another good one. It was all around the outside, I think.
Perfect.
Yeah.
So really using those muscles in the shoulder. These next exercises are a little bit more difficult because they focus a bit more on strength, so there's a bit more load going through your shoulder. So make sure that you're listening to your body and you're adapting them in a way that suits you. If you are post-surgery, then make sure you're talking to your healthcare provider, because depending on how many weeks post-surgery, that tells us what you can and can't do. So this next exercise is called resisted flexion. So flexion is when you bring the arm out in front of you, and to make it resisted we're going to be adding a weight. So for you, you can use anything that you have at home that's a little bit heavy. We're going to use a tin of beans. So you're going to take your hand next to you, and then you're just going to lift the arm up as high as you can and bring it back down. To make it harder, you can add a step forward as you do the exercise. So when you're ready, Chris, let's lift the arm up as high as you can go that's comfortable for you. And down. Good. Lifting up. And down. Up. And down. Good. Up. Down. And up. and down. Good. How do you feel, Chris?
That one was surprisingly hard work.
That one is a good one to make your shoulder much stronger. So just go as far as you can go and it will still help to strengthen the shoulder muscles. So we're going to make our abduction exercise a little bit harder. So we're going to grab our tin of beans again. So either starting in sitting or in standing, whichever is more comfortable for you, just lifting the arm out to the side, trying to keep your elbow as straight as possible and then bringing it back down. You can go up as high as you can in that arm. Good, up and down. So when you're ready, Chris, we'll lift up and down, up and down, up, down, up, down, up and down. How do you feel, Chris?
That was good. Very tight across the shoulder again.
Good. So we're going to make our internal external exercise harder again by grabbing our tin of beans for a bit of weight. So you can do this sitting down comfortably or standing up by keeping your elbow into your side, taking your hand away, keeping your elbow pinned into your side, and then bringing your hand to your tummy. To make this even harder, you can come and sit by a table with your elbow resting on the table and then dropping your hand down and then lifting it up to the ceiling. This exercise is more advanced after you've had your surgery. So if you are after your surgery, just make sure that you are clear to do this with your physiotherapist. So, sitting comfortably, Chris, elbow into your side, and we're going to take the tin of beans away from your body and then into your tummy. And away and in. Away, in, away, and in, away, in, away, and in. Great. How do you feel, Chris?
That was good. I felt very restricted on that one. I need to work on it.
It's normal to feel restricted when you're doing this exercise because the joint can be quite stiff, but make sure that you do it because it's a good one for all of the muscles in your shoulder. So our next exercise is called a wall push-up. You're going to get yourself by the wall with your hands at about shoulder height, but if it's more comfortable for your hands to be a little bit lower, then that's fine. You're going to lower yourself down and then push yourself back up and try and get your elbow to go completely straight. You can step closer to the wall to make it easier, and you can step further away from the wall to make it harder. Chris, would you like to give that a go? Okay. So hands on the wall, good. And lower yourself down and push up. Down and up, down and up, down and up, and down and up. Great. How did that feel?
I was really surprised by how hard that was. I thought that would be a lot easier than normal press-ups, but it's actually as hard.
Yeah.
Yeah, great.
So it's a really nice one because you're putting some weight down through your hands. So it's a good one for all of the upper body. Well done for following through with all of those exercises. For now, take some time to relax and recuperate because you've worked really hard, and definitely drink some water. Make sure that you stay hydrated. So Chris, how do you feel?
I feel really good. I feel looser and I feel more invigorated. I really feel like I benefited from it.
Perfect. And can you think of any time where you might be able to do these exercises in your day-to-day life?
Yeah, I was thinking about that while I was doing the exercises, and it's stood waiting for the kettle to boil, or sat on the sofa, or walking up the stairs. It's just thinking about how you move in daily life and incorporating them will benefit you without realising you're doing it.
Yeah, that's perfect. Thanks so much, Chris. Make sure that if you have any questions, you are speaking to your healthcare professional either before or after surgery. And do go and check out the Surgery Toolkit by Versus Arthritis for more information as well. But for now, well done, you worked really hard, keep up the good work and keep yourself strong. Take care.